Oncologists at St. Louis University Hospital have a new option for some cancer patients in need of bone and stem cell transplantation, the region's first outpatient bone marrow transplant program. The Center for Outpatient Blood and Marrow Transplantation allows patients the ability to return home each evening during treatment rather than face a lengthy inpatient hospital stay.
I think this outpatient center is the only place in the region that provides this type of care for bone marrow transplant patients, patients with blood cancers. And the advantage of it, frankly speaking, is we're able to deal with the majority of transplant care in patients who come back and forth to our clinic, as opposed to the patient remaining in the hospital for extended periods of time.
Bone marrow transplantation is an intensive treatment modality for patients diagnosed with cancers such as leukemia, lymphoma, and multiple myeloma. In the procedure, medical oncologists transplant cells into the patient's bloodstream to rebuild their system after chemotherapy, with or without radiation treatment.
Typically, bone marrow transplant's been done in an inpatient setting. It was thought at one point that the inpatient setting provided a more germ-free environment. We understand that the majority of infections in bone marrow transplant patients occur from the patient's own endogenous microbes.
In fact, studies have shown transplants on an outpatient basis do not affect survival rates. The journals Nature and the Journal of Clinical Oncology found no difference in clinical complications for patients treated in an outpatient setting as compared to those treated exclusively in an inpatient setting.
Right here, this is where our patients first come in when they're on the infusion side. So if they're getting any sort of treatments, any infusion, things like that, they're going to come into this side of the clinic.
Appenfeller says the center has two distinct sides, a treatment area on one and a consult area on the other.
We have 3 consult rooms, just a table and computer, and again, this is where family members can come and meet with the doctor, the nurse practitioner, social work, just to kind of talk about the plan.
Not all bone marrow transplant patients are candidates for treatment on an outpatient basis. A patient is eligible for an outpatient bone marrow transplant as long as they have a 24/7 caregiver. Oncologists also require patients who live outside of a 30-minute radius stay in lodging for a variable period of time post-transplant. Lodging options are available nearby, such as the hospital's auxiliary house, located within walking distance of the hospital.
I think the outpatient center just needs to be known to the patients in the St. Louis area as a extremely important option that they need to know about in terms of their care.
For more information, visit slewbmt.com.